I didn't start out noticing that women were underrepresented because in my cohort they weren't. However, when I started internship, my very first year in the hospital really, out of 52 interns, there were 7 women. So it was in many ways a somewhat isolating experience for women because nobody looked like us. That's changed. I was the second chief medical resident at my institution in the history of the institution. I was the first woman appointed in my division in the tenure track. But certain things have remained the same. So in some ways, there's still not that community of women at all levels. And I think that holds back women.
Well, the summit is an opportunity for a community of 300 women in academic medicine and healthcare to come together for a day of inspiration, networking, and skill building, specifically on the skills that are necessary for women to lead in the space of healthcare and academic medicine.
We know from the research that there are gaps in leadership when it comes to women in leadership, especially at the higher levels. But there are a lot of contributing factors to why this gap exists, and we believe that we can help with some of those with a program like this.
Any woman in healthcare or academic medicine, regardless of what level, whether or not they're an emerging leader, a mid-level manager, supervisor, or a senior executive, will walk away with some tangible skills that they can apply.
You know, I actually think it's really important to have a full mix of individuals. I think it's helpful to have women who are early in their career as well as senior leaders.
This conference, I think, is rejuvenating. It's refreshing. It really gives you an opportunity to step back and be self-reflective about the things that you want to do in your life and to recognize and understand that all things are possible. It just takes a little bit of planning, a little bit of determination, a little hard work.